Hi, Flavia.
Hi, Dr. Shahin. How are you?
I'm good. I'm good. How are you doing?
I'm doing very well.
Wonderful. I'm just making an adjustment. I've been looking forward to this.
Yes. And you?
So, thank you. Thank you so much. I wanted to let you know that I have heard so much about you, and I'm so excited to be talking. I've heard so many amazing things. So, thank you very much for talking. Just a little bit of water. Excuse me.
It's okay.
So how have you been?
I'm very well.
Okay.
Thank you for inviting me for this.
Yes, it's a pleasure. It's a pleasure. I really wanted some people to be aware of what you do. I want people to be aware of what lymphatic massage is. I want to know what we think the benefits are for fertility patients. So I just wanted you to start by letting everyone who is our audience today know exactly what it is that you do.
Yes. Let's start with some questions that everyone else wants to know about the fertility. I know everything, but the people need to know more, you know?
Okay, wonderful. So I wanted to let the people that are watching know I'm a fertility specialist, and I help people get pregnant and have
the
babies.
Best one.
Thank you. Thank you so much. But we also recommend certain things for people to do along with their IVF or egg freezing or fertility treatment.
Yes.
Some of them involve natural things. Some of them involve like acupuncture. Some of them involve supplements. But I think there's something very important about being able to relax your mind and to be kind of just thinking clearly and to relax your body that allows women that are trying to have a baby do really, really well.
Yes.
So those are important. And that's why we think that things like you do for the lymphatic drainage massage can be very, very helpful to many of our patients. Whether they're trying to freeze their eggs or whether they're just trying to do anything like that, I think it's really important. And I wanted to first, talk a little bit about the supplements that we can offer. Do you tell your clients to take supplements?
I never recommendation nothing. I just say go in the doctor. The doctor have the best information. I just all the time say you need to relax, make some meditation, Pilates, acupuncture, massage, and decrease the endorphin because this is the more important.
Yes.
This is my first question. What is the best supplements to take with someone wants to get pregnant?
So that's a really, really good question. And for women that are trying to hold on to their eggs or make the best quality of eggs, who are trying to do really well, I think we should take a prenatal vitamin, okay? I think there are other things to take such as omega-3. I don't like to give the fish-based, I like to give the plant-based omega because then it has no mercury in it. And then I also really like the supplement called CoQ10. It's an antioxidant, and the very pure form of CoQ10 called ubiquinol is really good for the patients. And on my Instagram, one of the posts a few weeks ago has this all written there. So you can easily see it if you didn't catch it all there.
Just start for this is enough.
Yes, those are good. Now, if you're older and you have very low egg count, there's some additional things we like people to do. But those supplements, such as something called DHEA, is not good for everyone, and you need to talk to a doctor. What I do during the consultation, always, we try to think of something really good to be able to give to the exact patient and also possibly the man as well.
Yes, maybe I needed this one.
No, no worries. We get it for you as well.
Oh my gosh, this is hard job. Don't worry.
No, it's easy.
The second question is what is the test that people need to do before they get pregnant?
So we have in my office many different tests, okay? Some of the tests involve checking to see if the fallopian tubes are open.
Yes.
It's called HSG, hysterosalpingogram. Another test that we do is a blood test called AMH. AMH is the best test to see if the person has a lot of eggs or very low eggs. It's from the blood. So you do one blood test, and you can check to see if the AMH level is high or low. And it's a very important blood test. We do them in my office all the time. Every woman should have an AMH done so they can see how fertile they are and what they should be doing. So very, very important blood test. And for the man is a sperm test. So we do those in my office as well. We have many more blood tests, like genetic tests for the husband and the wife to make sure they don't carry the same disorder. But overall, those are the basic starting tests that we do for people. We also like to check the thyroid. We like to check other hormones as well. But the AMH and the sperm test for the man are probably the two most important. And the fallopian tube test, and I do that right in my office behind this wall. We have a special x-ray room because the dye goes in with the x-ray and comes out the fallopian tube under the x-ray machine.
Yeah, in Brazil, this exam, the name is pterosalpingografia.
Salpingografia, yes.
It's
yes.
so big, like.
Yes.
Yeah, I make like 3 times to check. It's a little, it's good. It's a little painful, but it's okay.
Not when I do it, okay? So many times this is done by the radiologist doctor, but in my clinic, I'm the gynecologist, fertility specialist. I do it, and we're very, very careful. And
I know this.
Very little.
Yeah, I tell for my friends, say, go in Dr. Ghadir because he's the best, you know, feel pain. Because before, I feel a lot of pain in Brazil is not good at all. But yeah, you are the best. Yeah. The third question is, what is a good age for women to freeze the eggs?
So the younger, the better. Always, the younger, the better. The younger you are, you have more eggs. You have better quality eggs. You get more and better timing of your eggs. So the younger, the better. If you hit 30 years old and you still did not freeze your eggs, and you're not about to have all of your babies very soon, you must think about freezing your eggs. It's incredibly important. Even if you are the healthiest, the prettiest, the nicest, and your mom had a baby at the age of 45, it makes no difference. All of these things can have, there's still problems. So freezing your egg, the younger is the better.
Like around the 30s?
I have a patient that froze her eggs at 44.
Oh.
And then she came and she used the egg, and now she has a beautiful 1.5-year-old baby.
Oh.
So we have women who are also over 40 that use their eggs, but the egg, for some people over 40, even if we freeze them, is not very good. So the younger, the better.
Yeah, I know.
Always, the younger, the better.
Yeah. The one important question is, when should you see a fertility doctor?
So seeing a fertility specialist and seeing them on time is really important. If you're 33, 34 and you're getting married, and that's not very old, but let's say you want to have 3 or 4 kids. If you don't save some eggs or some embryos when you are younger, 33, 34 may be easy, but when you're 38, 39 and you want to have baby number 2 or number 3, when you're 40, it's going to be very hard. So in my opinion, the sooner you see the doctor, the better. You have nothing to lose. But waiting more and more is more problematic for most people. So the earlier you do it, the better. Now, if you've been trying to have a baby for 1 year and you're under the age of 35 and it doesn't work, you must see a doctor. If you are over 35 and you tried for 6 months, for sure, you must be seeing and going to go and have a consultation with a doctor.
Yeah, because 6 months is enough for, you need a doctor now.
Yes, and someone just wrote, I never thought about freezing my eggs. I'm almost 30 and I still don't want to have babies. I think I should. That's a perfect person, because many women right now, when they're 30, they don't want to have a baby. But they may want to have a baby later, and later, if it gets difficult, it's going to be a problem. That's why freezing the eggs now is a very easy process. takes about 10 to 12 days of injection, little tiny injection in the belly. And then at that point, people are just fine to proceed.
I don't know that people have more questions.
Well, I wanted to ask you some questions, Flavia.
Okay.
Can you please explain to us what is a lymphatic massage, a lymphatic drainage massage?
Yes, the lymphatic drain massage is just help increase the good circulation and the water inside the body. But specifically for this treatment is a little different because the drainage is good for everyone. But for people try get pregnant, the massage is a little different because it's like I need the more they relax the body than do something for drainage. Like the name the massage for people try get pregnant is like maternity. And the maternity massage was especially designed to help women who dream of becoming mothers. They help to produce of relaxation, contribute to the release of the endorphin, and decrease the level of the hormone, the cortisol, because the cortisol is the bad hormone for body in this moment, because they stressful everything.
And for man.
But for woman, have idea.
Very bad.
No, you have idea because you have wife. No, the cortisol is like a crazy hormone, and therefore reduce the stress because this is so delicate moment, because the injections they stressful and they have more stressful. I need just to relax the client. For client like go relax and decrease the endorphin is so bad for the body and the cortisol hormone. And addiction, they contribute to the reduction of glucose and insulin levels. This is another problem in the woman's blood, which favors the balance of female hormones for benefit to the ovulation. Massage helps to increase levels of oxytocin, the main hormone responsible to the delivery of the baby.
Yep.
This is the more important because it's like this time the female hormones is like going crazy, and the woman is like try to kill the husband all the time during this process. I will try just relax the woman and make all hormones going down and decrease the hormones for have like very good ovulation, for make the doctor job very easy.
Absolutely. So I love that.
I
Very
have
good
some
answer.
questions for you.
Yes, we had some really good questions. I'm going to go to them right now. Let me go ahead and see from the beginning what questions we had, but we had some very important things come up right now that I'd love to answer. So the first question that I saw that I really liked, was, would you suggest IVF or IUI for someone with a problem with the fallopian tube? And I want to explain to people what the difference is between IUI and IVF. IUI is intrauterine insemination. So we take the sperm and we push it up into the uterus, and it goes to the fallopian tube and then to meet the eggs. So it's all swimming on itself inside of the woman. If you have a problem with the tube, that is not a good thing for you to do IUI, because if this tube has scarring and is blocked or has any problem, it's going to be impossible for the egg and the sperm to meet inside the fallopian tube. The word IVF means in vitro fertilization. In vitro means outside of the body fertilization. We take the egg, we take the sperm, and in a laboratory, in a dish, just like this picture shows, we put the egg and the sperm together in the laboratory, and you don't need the fallopian tube. The fallopian tube is no longer needed. So if you have no fallopian tube, blocked fallopian tube, tied fallopian tube, the IVF is the better route for this person. So definitely, if you have a problem with your tube, you definitely do not want to waste your time doing IUI. The next question that came up was about polycystic ovary syndrome.
Yeah.
So when I was doing my training, I did my training at UCLA and also Cedars-Sinai Medical Center. I covered both hospitals, and I did my thesis for 1.5 years in the area of polycystic ovary syndrome. And for people that don't know about polycystic ovary syndrome, it's when people either have very irregular period, people have a lot of cysts on their ovaries, and they have a little bit more male hormone. So when they get hair on their chin or on their body, these are all things with male hormone, or they start to lose hair, okay? If you start to look like me, it's not a good thing if you're a woman, okay?
You're so handsome.
Thank you, Flavia. You're so beautiful.
Thank you.
For this, if you have any of these problems, you don't ovulate regularly. And every month, if your hormone is not very perfect, you won't release the egg on time, and then you don't release any egg at all. So for polycystic ovary patients, we also call it PCOS. We have special medication to help them. One of the first thing we ask the patient is if they are overweight, to please start to lose weight, because that helps these patients very much. So we have many protocols for patients with PCOS, and I have a lot of experience working with those patients. So if anyone needs help with that, we're more than happy to do it. For the cost of the consultation, if you go to my Instagram page, there is a website. My clinic is called Southern California Reproductive Center. Or if you send me your name, your email, your date of birth, and your phone number, I will send it to our new division that helps make the appointments. Right now, because of the COVID virus, we have a special pricing of $99, which is to help everyone. We don't want people that have had no job not be able to see a fertility doctor. I think that special is going to end soon, but right now we have that very good special to help everyone. And we're doing all the consultations by phone. The other day I did consultation with someone in Brazil, and
Really?
it was very, yes, I have had many patients from Brazil. And we have also have many gay couples come from Brazil to my office, so we have helped them as well. So we're able to help them, no problem.
Yeah.
So the next question I see, it says, when freezing the eggs and then having the process of utilizing that possibility, what can be done about weight gain? Is it inevitable? Estrogen and hormones are going to be haywire. So I have to disagree, because we have many people that do IVF and do egg freezing, and they don't really gain any weight. Your ovary, normally they're this big. And yes, when the ovary gets to be this big with lots of eggs all over them, your ovary gets big and you feel really full. But as the ovary begins to go back down within the next week, your body goes down too. Some people, the estrogen makes them retain some water. So a massage with Flavia afterwards would be absolutely perfect.
Yeah.
To drain the lymphatics and all the extra water that was retained in the body. But most of that body weight, which is just water, within a week is all gone.
Yeah.
So the more eggs you make, the more swelling you're going to get and more water. But usually within about a week, 95% of our patients are back to normal. And usually within about 2 weeks, 100% of our patients are back to normal. So there is no weight gain issue with this process.
Yeah, because here in US, during the process, the doctors say for people, you cannot make exercise, nothing. This is a little different than Brazil, because in Brazil you don't have this indication, and you need to continue to do massage for decrease all hormones, because this is make the doctor job very easy, and the belly is a little less the size. This is different massage, because I cannot press a lot the belly because the eggs. The massage is completely different for people who start the treatment for IVF or doesn't matter and just have the eggs. This is the difference from the drainage for this type of massage. It's a little similar, the massage, just the belly is very gentle. It's like for pregnant woman. It's like
right.
this.
And I have to tell you, many of our patients really, really enjoy getting massage during the 10 days of the IVF. Like, it's something that really makes them feel good. makes their body feels good. It makes the blood start moving. I think that it helps potentially move the blood better and the fluid in the body. And for that reason, I think that some of the patients even do better when they have better circulation.
Yeah.
I see another question here. It says, where do you keep the eggs frozen? All of the eggs that are frozen stay in our building. So we're in a secure building that has security guard 24 hours a day. All of the eggs are in a special secured location that is locked, that all of the tanks are frozen, the freezers and the tanks are tied down for earthquake. They all have generators. They all have alarms. Every single day, 2 of my embryologists go and check every single tank to make sure that they're perfectly fine. All of it, there's also on my phone, and many people in my office have the app where we can see the tanks. So they're in a very, very safe place. And we do have great, we have these special packages. If you want to freeze your eggs for 5 years versus 10 years, we have special packages, and that's been very helpful for our patients to get the price down for them.
It's very nice offset. Go check the offset.
Yes. What about weak sperm? So for weak, first of all, is there any kind of massage for men that you think can help their fertility?
Sorry, say again.
Do you think that for a man, massage can help better sperm?
No, because this hormone is just for women, is not for men. The men will have like the necessary hormones is like just for water retention, for this treatment for during the pregnancy, but it's like for men is no do nothing.
I see.
Yeah.
I see. Okay.
I have one question. Can I have the massage since the beginning of the no? The maternity massage, you need to go with the doctor and they indicate the doctor for like, normally I start between like 14, 15 weeks after the doctor give me that like the green signal, say you can start do massaging this client, but just after like 15 weeks is more safe.
So the reason we don't like so much massage in the first trimester is that there are some places in the body that if you massage a lot, it can help you have a miscarriage.
Yes.
And since not everybody is so professional like Flavia and may not know that, we think it could be a big problem if you get the massage in the wrong place after you try so hard to be pregnant and you can lose your pregnancy.
Yeah. It's not just for the first trimester, like the 15 weeks. This is for whole pregnancy. Do you have a lot of place you can miscarry your baby? This is so hard for you have baby, and because you do something wrong, you broken the dream that someone else. This is no like fair.
Right. And
okay.
And I think many massages people don't necessarily know all those places. So it's very important when pregnant, you get a massage only somewhere that knows very well how to do prenatal massage.
Yeah. How long?
I have a question that says about weak sperm. When we have very weak sperm, we are able to actually pick the best sperm under the microscope and inject it into the egg. Like I was showing before, this picture with the needle inside of the egg takes the best sperm, even if it's weak, and it pushes it into the egg. It's called ICSI, intracytoplasmic sperm injection. And that helps get the sperm, which is weak, into the egg.
Yeah.
The next question, Flavia, I see one that says, how long after a pregnancy can I have the AMH test? The AMH test is the one that has to do with your egg reserve. AMH comes from the egg. So when you have many egg, you have very high AMH. When you have very low egg, you have very low AMH. You can do that test whenever you want. Even if you're pregnant, you can have the AMH test done. So we don't, if you're done with your pregnancy, there's absolutely no worry, and you can get the AMH test done, not a problem. Someone asked if you can develop PCOS after having children. And most of the time, someone may have a little PCOS in their body, but when they gain a lot of weight, it can make the PCOS much, much worse. So weight gain can make PCOS show and become really bad.
Yeah. Okay. And you can just send direct for him.
Yes, you can send a DM. And I try to answer all of my DMs all the time. Unfortunately, if it's going to involve a medical question, I don't answer medical questions on DM, but I'm more than happy to help you do a consultation and go through everything that you need to, and at that point, answer all the questions. What about endometriosis? Flavia, do you know what is endometriosis?
Yes, I have this.
Oh, okay. So
Since I'm like 18 years old.
Wow. So yeah. Endometriosis is when the inside lining of the uterus grows outside of the uterus. So every time someone gets their period and the inside of the uterus gets very inflamed and ready to have their period, everywhere outside gets really inflamed. So it's very, very painful. It also causes scar tissue. So the fallopian tubes, the ovary, the intestines, it can cause a lot of scar tissue. So the tubes don't work very well anymore. So what happens is that the fallopian tubes can be really damaged. It also can cause a problem getting pregnant naturally, and there are treatments. Many of our patients that have endometriosis, we recommend for them to do IVF to get the egg out and get the sperm out and to build it in the laboratory and not to rely on the fallopian tube.
Yeah. How can I monitor this?
How can I monitor the menstrual cycle if I'm on the birth control? And you cannot. If you are on the birth control, it's going to cause you to have a cycle that is not necessarily your cycle. So even a PCOS patient is not going to have a normal one. And my cousin from Israel is watching, so I'm so happy that she's watching all the way from Israel right now.
Yeah, my sister is from Brazil.
And she's watching too. Hello,
yes.
Sister. Hello, cousin.
Hi, Alessandra. Around 1.6. Yeah, I have one more question for you. Around 1.16.
So around 1.16 AMH level will get natural pregnancy. It's very difficult to say that, okay? Because it depends very much on the age. It depends on the sperm. It depends on endometriosis, PCOS, fibroids. The AMH 1.16 is average. It's not very good, but it's not bad. But you can't just say, will I get pregnant with 1.16? It's impossible, and there needs to be more work than that. I'm 43 years old. Should I look into IVF? Absolutely. You should look into IVF right now. Not next year, not in 2 years, but right now, because we have had patients 43 get pregnant with IVF, many of them, but some also no. So if you don't start now, you will never know if it's going to work for you. How can you reduce the water retention caused by contraceptive pills? Well, I think a lymphatic drainage massage may be a perfect way to decrease that.
Drink more water, make some exercise, help too. But the drainage is the best one.
The drainage is great. Exercise is also fantastic, and it helps for people's water retention to go down very quickly. So the brands of the supplements, if you DM me, I can get that to you. I just don't want to take people's time here right now. If a woman has an AMH of 0.13, can she still get pregnant? I have had a patient with that level get pregnant, but we also have some women at that level that cannot get pregnant. So you have to try and see your doctor as soon as you can. I don't know, unfortunately, any fertility hospitals in Uruguay.
Me too. Chicken came here.
But we have people from around the world that come here. So
Yeah.
you're welcome to come here, and we're happy to help you. And I love this. People had so many good questions. I'm so thankful that they were able to do that. And my final question I'm going to answer, how do you feel about freezing half eggs and half embryos, is that if you're going to divide them into half eggs and half embryos, you better have a lot of eggs. Because if you only have a small number of eggs and you're going to get a small number of embryos and a small number of eggs, then I don't think it's a great idea. I think it's better to do it 2 times than to do it that way. Flavia, thank you so much.
Thank you.
You are so lovely. And
Thank
now
you.
I see my wife absolutely loves you and adores you. Okay?
I love her. She's the best.
Thank
and
you.
because of her, I start my treatment. I lose like 10 kilos, 20.
Bravo.
For next week, I start my treatment for no freezing my eggs, but start my IVF because I'm a little old, and this is the time.
Don't
next
worry.
Week.
We're going to help. We're going to help no matter what.
Maybe just one. I don't need the 3.
No
like
problem.
just one. 3
No
is like
problem.
just for Jessica. It's okay. For me, it's like too much 3. Just one is enough.
Yes.
And
No worries.
next week, sure, I'm going for my first consultation. And thank you for enjoy. I hope everyone enjoy. Thanks for inviting me.
Thank you.
Yeah.
I wanted to just let everyone know, if anyone needs to make a consultation, you can either go to the website of my clinic, which is Southern California Reproductive Center, or you can DM me with your name, date of birth, email, and phone number, and we're happy to send that off. But we're happy to send that information to our coordinator so that they can call you, okay? And we'll help you schedule it up.
I saved this live and I put all information after everything just for people send message, but I saved the live. Don't worry.
Thank you. Thank you, everybody. Have a good night.
Bye.
Thank you so much, Flavia. Muito obrigado.
De nada.